Hello and welcome to Health Matters on Channels Television. We are glad you could join us. I am Mary Alale Yusuf. Worldwide, sickle cell disorder is the most common inherited blood disorder. Of approximately 3,000 babies born globally with the disease every year, 150,000 are right here in Nigeria, giving us the infamous title of sickle cell capital of the world. 50 to 90% of those born in Nigeria do not live to celebrate their 5th birthday, but experts say they can if their parents and caregivers have knowledge about the disease and the children have access to appropriate diagnosis and care. Indeed, it is on record that some have had children and lived into their 70s, 80s, and 90s. How did they achieve this? The malady is associated with severe shortage of blood, terrible pain, and serious complications such as stroke in children, among others. My guest today is Consultant Public Health Physician, National Director and Chief Executive Officer of the Sickle Cell Foundation Nigeria, Dr. Annette Akinshete. You're welcome to the program.
Thank you so much, Mary. Good to be here.
Well, first of all, congratulations are in order. 30 years of Sickle Cell Foundation in Nigeria, caring for people with the disorder. How has it been? How does it feel? Did you think it'd make 30 years?
Well, I would say it's gratitude. We're in that place of gratitude and thankfulness that, well, 30 years ago when Sickle Cell Foundation Nigeria was established, I was not
Sickle Cell Foundation, but I was working with Sickle Cell Foundation
Nigeria.
I was in charge of
non-communicable diseases
in the Federal Ministry of Health at the time, under which sickle cell falls. So yeah, I remember that prior to that, we had done a survey, a national survey all over Nigeria to determine how much sickle cell really had, but not just sickle cell, all other non-communicable diseases. And that's when talking hypertension, diabetes, and all that. Okay. So at that time, I met Professor Oluwakinyoju. He was the expert on our National Expert Committee on Sickle Cell Disorder. He was the expert for sickle cell, just as we had experts for the other conditions. And he already mooted the idea. When we had the survey, it was in the 80s. And that was, I don't know if you can calculate, that was years ago. So he already was thinking about it at that. Government is beginning to think about doing something about sickle cell. We brought it under non-communicable disease. Mind you, in other parts of the world, because it was globally, NCDs, non-communicable diseases, were becoming an issue.
No.
Exactly. So our Minister of Health at the time, Professor Olikoye Ransom Kuti, in his wisdom, and as a pediatrician, he had seen that Nigeria had better add sickle cell to the NCDs. Internationally, it was hypertension, diabetes.
Yes,
and
you know,
that.
that's funny. It never occurred to us. I mean, most of us walking up and down every day who are not in the health sector, that sickle cell is actually a non-communicable disease, a chronic one too.
Exactly. So Professor Olikoye Ransom Kuti felt we should add it to our own, NCD program. So I was in charge of the NCD program at the time. And so that's how I met Professor Akinyoju. Akinyoju was already thinking ahead to say that, okay, there needs to be a foundation, an entity, a center. And that was actually in response to WHO call that in any country where a condition is determined to be of public health significance, there should be a center established, dedicated to that condition, to all aspects of it, particularly research.
But do we have these centers all over Nigeria
Our
now?
center is the National Sickle Cell Center, and it was established by Sickle Cell Foundation Nigeria. But that's because government, remember, cannot do everything. I think we emphasized
we did emphasize that
this week, and for that reason, there was a gap. And that gap was what Professor Akinyoju thought to fill with Sickle Cell Foundation Nigeria, establishing the National Sickle Cell
And now
Center.
you have your hands full.
Very full.
When you started with caring for sickle cell disease, how was it? And compare that to now.
We've come a long way. A long, long way. I take us back to that survey. At the time we had this, I am saying with a lot of pride, because to have a community survey, that you go into the community to look for conditions that are chronic, or conditions like sickle cell, you're not going to find a lot of them in the community. You find them in the hospitals readily because they come.
Okay.
But community-based surveys are very expensive to carry out. And besides that, you may see at the end of the day what is the yield. But remember, at that time, Mary, parents did not bring their children out to say my child has sickle cell. Or when we asked, it was
somewhere
usually be
still
neighbors.
thinking that this is Ogbanje Abiku or something like that.
Exactly.
I better not speak, or they will think it's in our family.
Or spiritual or witchcraft. And you know, at that time we engaged a number of people talking, and we say, oh, in Yoruba they would say wadi, that is find out before you marry into that family.
Okay.
The kind of things they find out.
Yes, inquiry.
Include sickle cell. They had a way of asking about it, and at the time it was Abiku, yes. And some who knew better would say arumolego, something to do with pain in the bones. But the beauty of the Yoruba language is that it's evolving. And do you know that in Yoruba language now they have evolved a word or a term to describe sickle cell disorder that speaks to
from that superstition.
Exactly, that speaks to the anemia of the condition, and is sejedole. I don't know if you understand Yoruba. It means that which makes the blood weak or lazy.
Okay, makes the blood lazy.
Lazy, exactly.
Yes.
So it speaks to the anemia of the condition. So there's name recognition. There's name recognition. People are coming out more. And then at that time, it was Sickle Cell Foundation Nigeria only. But do you know that now we have a lot of NGOs, non-profits, that have come on the bandwagon, ready to work to raise awareness, which is mostly as they're there for advocacy. They want to increase awareness, and awareness has increased. I can't say I know empirically how much, but I know that if I go into the community, more people are talking about sickle cell. My child has sickle cell, or sickle cell 1B, you need sickle cell. So people are talking more about it. So in terms of name recognition, in terms of people knowing about awareness, it has improved. We haven't got where we want to be, but we have come a long way. We've come a long way. There are many other advocacy groups, support groups, everybody on the bandwagon.
So let me ask you, you have this awareness jingle that says a pain-free life is possible. But we know that sickle cell anemia comes with a lot of pain. The chest syndrome, the leg ulcers, all those things.
Yes.
Now, how is it avoided? How is this pain avoided?
How is the pain avoided? You have to dial back to the very beginning. How do we prevent sickle cell from happening in the first place? But that means a lot of education, and we talked about newborn screening, testing in time to be able to determine not just those who have the disorder. If you find out those who have disorder as newborns, then immediately we can institute treatment, preventative measures. Like I'm talking now about antibiotics. I'm talking about vaccinations that prevent the infections that kill our babies before the age of 5.
Okay, so you've introduced something new here.
Okay.
That infections kill the children before 5.
That is mostly it. Mostly die from it.
Not sickle cell anemia.
Sickle cell anemia is what makes them vulnerable to those infections. There's a particular infection called salmonella.
Okay.
That they are more vulnerable to, more liable to get than the general population. That's why we're talking about those immunizations. Of course, you get the routine immunizations.
Because, parents can come up and say, I don't know why you're talking about immunizations. Yeah. I'm telling you this child is going through pain. Yeah. So, you have to make that link.
Yes. So that's part of education, counseling. Our time is so short to describe everything that you have to do. Counseling, as I'm speaking now, I remember Mama Otaigbe in our center. Counseling is a big part of management of sickle cell.
Okay,
so once it's diagnosed, you bring the family in.
I actually want to talk about that.
You bring the family in for counseling immediately.
From what I know about the Sickle Cell Foundation, nobody is going to come and tell you, you are AS and that man is AS. Mm-hmm. Don't marry him. No, correct. They wouldn't do that.
No.
But they would talk to the person. So how do they talk to the person? What's your alternative?
Okay, what options?
Giving the person an order, no, don't marry that person.
Yes. Okay, as counselors will tell you, they are certified counselors will tell you, it's not your place to ram your opinion down the throats of couples that come to you. to say we are here for counseling because we're going to get married or we're going to have children together. What do you think? We're both carriers of the sickle cell gene. So they know already that they're liable to have children with sickle cell disorder. But it's now for the counselor to lay everything on the table, the facts. That this thing you are talking about is not a stroll in the park. It's not easy. They will even bring to you and others who have the condition to share their experiences. Children, you see other children who have the condition. They give you materials to read. It may not be a 1 day or 2 day thing. It may be a series of engagements, so you know the facts. Then you make up your own mind. But then you may ask, and they will tell you anyway, even if you didn't ask, what options, what alternatives do I have? And they say to you, oh, you're at an age, which is what I heard the other day. We're in a time when we should be happy that there are alternatives, there are options. And these are like what? Prenatal diagnosis.
Okay.
So you can determine the genotype of your child before the child is born in early pregnancy. But again, that is fraught with some religious, sometimes ethical considerations.
Ethical
because they will ask you, yes, okay.
You check, so what are you going to do about checking?
Okay,
you can't remove it.
Exactly. So because in Nigeria, it's still a crime to have an abortion. But many mothers will ask, can we have an abortion? We don't offer abortions in our center. Ours, as a matter of fact, is a form of early diagnosis.
Okay.
Because remember, like we discussed during the week, a baby born today with sickle cell disorder, you can't tell the difference between that baby and the child who does not have it. Even the regular tests, usual tests, will not give you the results of that child. You are going to be getting a result that says, aha, this is a fetus type of hemoglobin. So it's around the age of 7 months, 8 months, 9 months, when the child already has symptoms and signs and those infections, that you can get the test results. So when we do prenatal diagnosis, we're looking to catching them even before they're born. So as soon as they're born, we take them under our wings in Sickle Cell Foundation Nigeria and begin to treat them with antibiotics, the vaccinations, ensure that they get all this and put them in care. See, we're not a hospital, but we link them up with the pediatricians that take excellent care of them. So by the time these children reach the age of 5, they do well. Those infections, those are the things that tend to kill our babies before the age of 5. I think the statistic we shared is an estimate of over 150,000 babies being born in Nigeria every year. And over 100,000 do not live to the age of 5. And that is why we tell the government and every so often, look, we're talking SDGs. SDGs will end in 2030, almost 5 years' time. So we need to, Nigeria needs to be able...
And if sickle cell is not caught up in that, then the job is not done.
Sickle cell is, as a matter of fact, if you hit those 100,000 plus children, then you'd have dented that statistic. So Nigeria will be able to boast to say under 5 mortality has been reduced. That is target 2 of SDG 3, which is health. So it's a low-hanging fruit, if you like, for government to say we have been able to achieve this. And I think that's the way to go if we want to.
Okay, let's go to some of the things that the people living with sickle cell anemia spoke about during your town hall meeting, about not getting access to healthcare, not getting access, not being able to be treated under HMOs for their sickle cell anemia. And you said you're coming up with an innovation, an initiative called the wish list. Can you tell us a bit about that? Wait list.
It's a wait list.
Wait list, sorry.
The wait list, because this we got inundated with requests. Sickle Cell Foundation Nigeria, how come you're not here, you're not in Kano? How is it you're not in Sokoto, you're not in Ilori? And I said, look, they think we're government. We're not for profit. NGO working in the sickle cell space. We work with government in terms of like a public-private partnership, but we're not government. But we can go around and
Can I
reach
pause you there and go on a short break? As soon as we come back, we're going to talk about this wait list. It's important. Please stay with us. You don't want to miss the wait list. Welcome back. It's Health Matters on Channels Television. And we were about to introduce the wait list. But before we go into that, you might have some questions. And the number to call is 0802 054 2233. You can also send a message at CTV_Mary A. And while that is going on, we'll talk about our wait list.
Excellent. Thank you. I think that will be Sickle Cell Foundation Nigeria's gift to Nigeria in this sickle cell business in this our 30th year, because we've got a lot of information from everywhere. And the problem really is persons with sickle cell need to be on treatment every day of their lives. And they're spending out of pocket. You may say something as small as folic acid or proguanil to prevent malaria. Now we have hydroxyurea. Many patients are on hydroxyurea to prevent crisis and all that. And what about antibiotics, painkillers and all that? Out of pocket. You mentioned HMOs earlier. We have been engaging with them. There's a particular NGO that was established recently in Abuja, and he's in a niche where his own is just to engage with HMOs. I want you to register patients who have sickle cell. But what's their experience? They will say, okay, you can be treated for malaria, you can be treated for typhoid, but we can't treat you for this. And those are things that pertain to you and your sickle cell. So we in Sickle Cell Foundation Nigeria sat with other NGOs and some other stakeholders and came up with this idea that government can't do everything. We have asked that children under the age of 5 be treated free. We've been waiting and waiting and waiting. It's not happening. But we also know that the private sector, banks, oil companies, moneyed companies, entities like that, they want to engage, but they don't know how to.
This is beginning to sound like COVAX.
Thank you.
Like when there was COVID-19.
Thank you. See how they jumped on and everybody worked together. And I see that already here. They want to engage. They want to be part of it. They want to give back. Oh, there's CSR, which is policy. But then, even with CSR, they're not so sure how to engage.
And
so this is a platform.
Let's quickly take a call.
It's a platform for them to engage.
Ogunyemi Magodo, hello.
Good afternoon.
Good afternoon. What's your question?
Good afternoon.
What's your question?
I want to ask, is it possible for somebody with AS and AS who are married to have a child, AA?
He's asking.
Married couples who are
okay,
AS
you're still there.
And AS, can they have a child, AA?
Who is AA?
Yeah, that's his question.
The simple answer is yes.
There you go.
That couple, AS and AS, we call them carriers of the gene, that they have a sickle cell trait. So it's a chance thing, though. And that's one of the points that Professor Falusi was emphasizing at the town hall meeting, that it's not a case, we hear 1 in 4.
You can't calculate it. It's a probability.
Absolutely, and it's in every pregnancy. So a family of 4, that is say, it doesn't mean that one child in that family would have, a family of 4, that child will have, one child will have sickle cell and the others will not. Is that in every pregnancy, you just present like a lucky dip to the mother. Pick one, and out of the 4, you have AS there, 2 ASs there, 1 AA, 1 SS, and the mother picks one. The mother in the first pregnancy can pick AA. Second pregnancy can come and pick AA as well. Third pregnancy and so on. But the reverse is also true. The converse is true. The mother can pick SS the first pregnancy, pick SS second pregnancy. In real life, it's true. In medical school, we had a family of 7 children, all SS. And the parents were carriers. But again, converse is true. There's a family we know here, AS, all 4 children, AA.
But nobody needs to know
even
what they're picking in the lucky dip.
That is it. So it is chance. It is chance. It is chance. Having said that, I was Bolariwa who said yesterday we're at an age where we should be happy that we're able to deal with sickle cell in many other ways. So there are many options, and advances in the sickle cell space in area of prevention and area of cure as well. Prevention, they talked about yesterday, pre-implantation genetic diagnosis. So even before the mother is pregnant, they select an embryo that's free from sickle cell and implant it in the mother, and she carries the baby to term, and that child will not have sickle cell.
Let's quickly take a call from Okorafo, who is calling in from Abia State. Hello, Okorafo. What's your question?
Yeah, that's Mazuka from Arujuku in Abia State. Good morning, doctor. Good afternoon, doctor. Good afternoon. So I want to find out from the doctor, that there is need for them, this sickle cell issue, that they'll be drinking plenty water and eating plenty fruit. What's the rationale of plenty fruit? And secondly, the issue of, there was a test, somebody showed that they went for marriage course. And the first instance, after doing the marriage course, before they started, they did the test, the man AA, the wife AA. But in the conclusion of the marriage course, start having AS and one AS. What must have caused such a situation? Good afternoon. Mazu Crawford from Arrow.
It's a good one.
That is the case of inaccurate test results.
Yes.
Okay, that's very common. Very, very common. In our laboratory, is a reference laboratory. That's where it's like a final arbiter. Hospitals, doctors, name it, they come to us, and individuals walk in as well to be sure that this what happened. This is what's going on. We are both. My wife is AA, and how come we have? And this has caused problems in families amongst couples as well. But it is inaccurate test results. In our laboratory, for instance, we have 3 levels of validation before a person is presented with the result. And I don't really blame some laboratories. It's maybe no fault of theirs. There's really no standardization. I don't think it's adequate regulation or certification. There should be. So that is, we're engaging with government in that regard at all levels.
So there has to be another level of
it's not in all cases. The common test that's done is it's called electrophoresis. And it's the way the proteins move on a sheet, let me put it that way. So, and the bands are read off. If you see an A along, if you see a band along the A line, they will say A. They pick it up as A, pick it up as S. But there can be errors. Okay. There are some cases where you know that, if this and this happen, I'm actually seeing what we call G. There's something called hemoglobin G. There are other hemoglobin, there are tons of hemoglobin, over 100.
And the Sickle Cell Foundation can handle all this information.
So we can help situations, people in situations that are dicey, that are not sure of their results. And people have come to us to say they want to do prenatal diagnosis because they are both carriers, AS and AS, only for us to find out that, this person is not really AS. She's AA, so you don't need prenatal diagnosis. So
can you quickly answer the question, Okorafor's question on fruits and water?
Okay, water is absolutely necessary because it helps the blood to move along. If you remember, Mr. Okorafor, that as we have explained many times, the blood in sickle cell the blood cells stick together, and because of the shape, the shape is not nice and round, they just block the blood vessels. So blood does not reach your end organs and reach your tissues to carry oxygen where you need it. Okay, so for that reason, you need plenty of water to push the blood cells along, to push blood along. That's a simple way of explaining that. As for fruits and vegetables, Mr. Okorafor, you and I need it as well. Everybody needs to eat a balanced diet. And one of the best things I've heard about balanced diet from an expert nutritionist and dietitian is make sure that your plate is colorful. And the things that give your plate the most color are fruits and vegetables.
Fruits and vegetables.
You see red, yellow, green. Orange. You see that you're on the right path. And the thing is, what do? They help to reduce inflammation in the body. And it's inflammation in the body that tends to cause the crisis in sickle cell. Anybody who will have inflammation, have an illness. So it's for all of us, but it's particularly for persons who have sickle cell disorder, to eat balanced diet and ensure that take plenty of fruit and vegetable. Fluids, yes. Water, exactly, but no sodas, no minerals, please, because they cause inflammation. The minerals.
What a wonderful place to land on this topic. There's something you've got to do when you come back again, and that is we're going to talk about the wait list a bit more, and we're going to talk about bone marrow transplantation. That's our, that's on our plate already for the next time. Thank you so much for coming again and giving us this very dynamic session.
Thank you very much.
Ogunyemi Okorafor, I can't thank you enough. Those were such well-informed questions. And all our viewers, thank you for joining us here. I am Mary Alale Yusuf. Have a wonderful day. Bye-bye.